Hi, everyone. My name is Nikki Ranadive. I'm an emergency physician in the United States, and I have the unique privilege to moderate our wonderful panel here, um, who hail from the Partnership for Sustainable Development in Nepal, as well as the University of Colorado. Our panelists are part of a broader interdisciplinary effort to expand innovation and research in the climate and health space, particularly in Nepal and other resource constrained settings. And we're hoping to focus in particular today on uh, community led solutions to reducing climate and health burdens. And Our first question is for Dr. Suman and Mr. Bishnu. Could you please explain to us how climate change is impacting the health of people in your community?
So, uh, so at the very outset, thank you, Climate Health Foundation and Climate Medicine, for this opportunity to bring in the very genuine insights from the low middle income countries and the community people living there. So it's a great question, like how climate is impacting our community people in low middle income countries. It's a multifaceted problem. It's impacting in various ways, including the health, the development, and the economy of people. In particular, there are emerging issues with infectious diseases in those people, with anxieties, with mental health issues, and in our part of the world where the out-of-pocket expenditure is huge, it's really impacting on that part as well. And in addition to that, there are issues with food insecurities that enhances that accelerates the issues with malnutrition problem that's already prevailing in our part. And there are displacements and migration happening, which is also a big issue. So it's impacting our community in multifaceted ways.
Yeah, thank you for the opportunity. I just start like a small like a story. 8 years boys from the rural community, how the climate it impacted to the local community who have not done anything to change this climate. Okay, picture of the scene like young 8 years old boy approaches you and poses the peasant questions. Okay, there was no rain, no dark cloud in the sky, nothing threatening, but still it happened. The incident I can never forget. Suddenly, a colossal thundering sound engulfed our community. A massive mudslide swept away our homes, destroyed our crops, buried people, pets as well. I lost my parents in an instant. I became an orphan. I don't think I made any mistake or did anything wrong. Did I? Yet my life is ruined. Why am I suffering so much? Who is responsible for my situation? During our interviews with the children affected by the devastating accident, this question came to us, but it is by no means the only one. We were surrounded by those affected by the terrible landslides. A community torn apart, family devastated, children made orphan in a flash. The heartfelt questions of the boys left me speechless. How can we respond to such a profound questions? Who bears responsibilities for the suffering of this child and countless other affected by climate change? Our adults, how can we ensure justice for him and the many more children grappling with the consequences of the environmental upheaval? This is a story what like a paper what we are going to write and taken from that while doing the interview with the small kids who are the orphan because of that landslide project. On this, I just wrote a small poem. I just would like to say this one. Like in Nepal's embrace a sorrow till the unfold. Mudslides, sorrow, untold, innocent soul. An 8 years old, bereft and forlorn, asks why suffer? Who bears this scorn? No rain, no dark, cloud it, cows come. taking lives, leaving us all in shame. Responsibility, a question dire. For climates told who is douse the fire. Adults ponder, seek away justice for the young in this era. Urgent queries seeking light in nature's unheld set thing right. Thank you.
Mr. Bishnu. And to follow that up, we were hoping to play our first video.
As we kind of load the video here, I just want everyone to pause and think about a couple things. Number one is, as you hear the local reflections and experiences, think about the word community. What does community mean to you? Because really, at COP, we're here in Dubai celebrating community as global citizens. And really, this idea of local to global can happen, but also global to local. So as we talk about community, what are solutions if they are not community led? You're hearing the lived experiences that are perhaps very different than where you live, but I bet they're very similar to where you live in many ways too, highlighting the disproportionate impacts to specific groups, notably young children. And in many countries of the world, you think of Nepal being between China and India, it is Earth's third pole, and there are a myriad of climate impacts. But as we move forward, think about community. And then number two is calling out each and every single one of us on this panel. We have a clinician, we have an executive director, an organizer, a partnership for sustainable development Nepal, a researcher, and a policy expert. What would it look like if in all of our arenas of decision makers, we have the expertise of lived experience of professionals, including the health voice, in order to better scale some of these solutions that are already available. So we have two videos here we'll share, just highlighting a few of the solutions and the work that communities in Nepal are already doing as we move forward in a warming planet.
The climate is changing. Atmospheric CO2 is at dangerous levels. We need to rapidly cut out carbon emissions, yet lots of our current activities continue to contribute. PST Nepal and CREED are launching a carbon offset scheme by planting trees in the Langtang Valley of Nepal. These trees will do at least three things. Firstly, they'll boost a local carbon sink by catching carbon. Secondly, they'll restore critical ecosystem services and local resilience. And thirdly, they'll help repair the damage done by the 2015 mega earthquake. PST are also partnering with local schools to encourage local tree planting on their grounds. We are excited to partner with incredible community of Langtang to help build the resilience of the Himalayan landscape and inspire the next generation.
So the next question is for Dr. Suresh and Dr. Rubli. Could you please give us some examples of how you and your teams are addressing some of these issues through science and policy?
Yeah, thank you. Yeah, when we talk about the policy, our thinking is to how we breeze the finding from research into the knowledge first and carry that knowledge into the policy. Often developing countries around the world, either they directly think about the policy right in a closed door environment and implement that policy. So how practical that policy is, and whether nowadays we talk about the climate and its impact to the human health, and we used to talk about the out-of-pocket expenditure that, as Dr. Suman mentioned, that country like Nepal, every year more than 600,000 people pushed into the below poverty line because of excessive health expenditure while accessing basic and tertiary level healthcare services. So who are they? They are the people. They are the poor people. They are living from the mountain. You just saw the access to healthcare services for them is nightmare most of the time, and they are now forced to be poor because they are living near to the nature, because they are protecting our mountains, because they are planting the trees, and they should not be, due to the health cause, be poor and lose their life. So we are health professional here. So our thinking is how we protect these people, think through more carefully, practically, so that we can protect the people. And first, as a health professional, doctor, nurses, and clinician here, and we need to think about how we make our healthcare delivery system people friendly, efficient, and so that we talk to the policymakers and we breeze this thinking in the policy that the health and the climate policy talks together, and the required finance is there. And if any country in the world think that I am financing enough to my country, for example, if a Nordic country think that, okay, my per capita investment in health is enough, I think that would be a wrong narrative for today's world. So if everyone need to be safe in order to produce the safer world. It's not only the infectious disease, but it is a slow pandemic of the climate change. It is really giving a huge pressure and stress to our healthcare delivery system. And we bring to this multifaceted reality thinking and the data into the policy. And the policy need to be financed, costed. Without costed policy, it will be all the storytelling and the like a dream of the people. Let's not make the policy that's like a dream. Let's make the policy backed by the science and the data and the commitment to through the national financing, domestic financing, and global financing. I hand over to Dr. Kathleen for more.
Yes, you make such important points. We need financing, but we also need research and innovation to drive a transformed world, right? There's so many solutions out there. And I pose the question to you all listening. If you were to build a hospital in Nepal, where would you build it? Where would you build it? Would it be in the mountain region, the hilly region? In the flats, right? And what would you put into it? So thinking about all the different science and resources available is really important. The World Health Organization has frameworks for building low carbon and climate resilient health systems, which are phenomenal resources to think about implementation and using implementation science in any sort of public health solutions. The second thing I think about is really getting all of your stakeholders together and saying, what are our local climate hazards? We heard about some of them here. The communities will tell you what the number one, number two, number three priorities are. And so thinking about inland or coastal floodings, maybe wildfires in your specific region versus the Himalayas are melting and it's going to affect our water quantity and quality moving forward. What does that mean? So as you build infrastructure, as you develop solutions, think about the latest climate science from, I'm sure you all have read it already, the most recent Intergovernmental Panel on Climate Change sixth report, right? So dense content, but essentially taking the latest climate science and saying, how do we incorporate that into our built infrastructure, as well as the health impacts and opportunities as we move forward. I'm not sure if you heard, but mortality in highly vulnerable regions of this world is 12 times that of very low climate regions. 12 times just because of where you live. That's not okay, right? That's not okay. And so as Dr. Suresh said, how do we think about policies as possibilities to scale clean and healthy solutions as we move forward?
And what are some barriers that your team has faced while implementing your interventions?
Yeah, few things like climate change is impacting our lives, so we need clean air. That is like a best thing. Other thing I used to say that we have done already too much damage to our planet, and let's invest more to the early years so that we can generate produce the better generation who can better care our planet. That is a other point I want to make. Another one is because I have been working in the rural community in Nepal, who are the underprivileged and vulnerable segment of the community people. For example, there's a landslide and breeze blow out, and there is a woman who are about to give the delivery, and because she cannot go to the hospital because of the road is blown out, because of the climate change, because of the flooding, she is suffering. She is losing her life, losing her baby's life. And in Nepal, they cannot airlift because they don't have enough resources. They cannot afford it. So there is a very, people say this is very small issues, but huge. If you count the life, there's so many people are dying because of the climate change impacting the people who are living in the community. Okay, thank you.
Thank you. And I think we're starting to run out of time. We have about 2 minutes left, so I'm going to skip through some of these questions. But this is for everyone on the panel. We have a lot of clinicians in the audience today that are potentially interested in engaging with your organizations or organizations similar to yours. And so the question is, what does an authentic partnership look like between your organizations and clinicians?
So yeah, as of clinicians, there should be the champions in advocating about the intersections of climate change and health. There are many ways that clinicians can partner with organizations like ours, community organizations like ours, in terms of educating people in understanding how climate change impacts their health. For example, respiratory illness. For example, like how waterborne diseases are in coming from disruption of quality water systems. In addition to that, we can collaborate to generating evidence, to understanding what are the concurrent priorities in particular populations and finding effective, innovative solutions.
And quickly on the training to, health workers, you guys, clinician and trained nurses here, we need more skill to the frontline health workers working in Himalayan region and the hilly region, and they need core skill how to work in the emergency and how to provide the emergency primary care at the emergency situation would be one. Maybe how health workers can engage in generating knowledge and disseminating the knowledge. And fourth thing we can partner is create the voice that starts from mountain region of Nepal, and it is spread across many mountain regions of the country, because Nepal, we know, many people know Nepal as third pole. Let's generate the knowledge from third pole and disseminate that knowledge to the benefit of people living in many more mountainous country and beyond in the world.
Yeah,
Their partners.
In addition, maybe clinicians can work out in advocating, in integrating the policies, in prioritizing the environmental determinants of health. So that would also be a critical point to be included.
I would just like to reiterate the humility that all of us need to bring as we move forward in an uncertain world. And I think I'm the last person that needs to say this out loud, but I am so extremely humbled to learn from you guys and your experiences. And so as we move forward together, I think that's what it's going to take, is a little bit of humility and curiosity, as well as we have heard, imagination, to implement the transformative health systems that all of our communities, countries so desperately need to address this crisis. And like we have so many times before, we will. And I think, having each and every single one of you in your busy lives here in this pavilion today to come to Dubai to advocate for your patients, for your communities, is just one small testament to that beauty. And if collectively we can come together and use the latest research and science and innovation, I am so excited to see what countries like Nepal can model to the rest of us as we move forward.
All right. Well, thank you all so much for your time. For those of you who are interested in learning more about climate and health solutions in Nepal, please feel free to check out a paper co-authored by our panelists here entitled 3 Climate and Health Lessons from Nepal Ahead of COP28, published on the National Academy of Medicine website. And I'm not a co-author, so I don't have to be humble. It's a really good paper. You should reference it in your papers. Cool.
Thank you.